Hello everyone, my name is Nichole Stephens, and today I'm going to be talking about the culture of Jordan. So to start off, Jordan is an Arab country that is located in the Levant region of Western Asia. Jordan has three major physiological regions that range from the desert, the uplands east of the Jordan River, and the Jordan Valley. The dialect of their language can be dependent on which region they're from, but Levantine Arabic is spoken by the people of Jordan for the most part. But there is also dialects like Bedouin Jordanian, which is used by those who live in the desert or east region of the mountains. Haran Arabic. This dialect is used by the people found in the north and west areas of Amman, between Salt and Arabid in the extreme north. Moab Arabic is spoken in the region of south of Amman, in towns such as Shubak, Man, Tifla, Karak, and their countrysides. They have a population of about 10.10 million as of last year. So their religion, the majority of people that live in Jordan share the faith of Islam, and they're referred to as Muslims. The holy text is called the Quran. Their faith has a major influence on their culture. They have a spiritual priest that can act as healers in times of illness that are called imams. The prayer they use in times of illness is called the four du'as, and they usually just use about one or two of those, depending on the person and the situation. They typically pray about 5 times per day and use special prayer rugs. Men and women are separated during prayer. Religion holidays include Ramadan and Eid, in which they fast from sunup to sundown. And that includes liquids and food. Religion nursing considerations. So Muslims may see illness as God's will and perceive illness as a trial by which one's sins are removed. When a patient is in prayer, do not interrupt. Exceptions to the religious holidays include the ill, pregnant, breastfeeding, menstruating, and prepubescent. Assessment for exception may be necessary because some may think that they're not ill, so you have to really see if they're going to fast or not. Bathing of the deceased may have certain sequence, so it may be up to the family. They may want to do it. A lot of the times they have to wash their whole body before they can touch the deceased body. Social roles. Men and women are typically kept separate due to the religion. Men are taught to keep their gaze at the ground and not make eye contact with women. Men are typically the shelter providers and providers of food. They're the primary decision makers of the family. And women typically have the role of raising children, taking care of the household, and are expected to bear children soon after marriage. And they typically also take care of the ill. For the elderly, so they are usually regarded with the highest degree of love, respect, and wisdom, and are looked upon as a source of inspiration in the family. The elderly have roles in helping raise the young. They actually have really strong ties to the young, and they are typically taken care of by the eldest son. So nursing considerations for social roles. Having the same gender healthcare provider may be requested. Because men are the primary decision maker, it's important to ask who the nurse should refer to about healthcare decisions, especially if it's a female. The extended family may also need to be consulted in all important decisions. If a woman has fertility issues, it can be a great concern for the family. The sense of duty and responsibility of the family for the elderly may influence decisions like not considering placement in long-term care. So the view on illness. As I said before, illness is sometimes seen as spiritual life force imbalance and as God's will. They may delay seeking health care until the illness is in the late stage, so it's important to assess the onset of illness and what they believe caused it. The main reason why they really delay health care is because they try their traditional remedies beforehand. Mental illness is seen as worthy of disgrace. So common health problems are hypertension, heart disease, stroke, cancer, diabetes, lactose intolerance, tuberculosis, and major depressive disorder and anxiety. Smoking tobacco products at a young age is common for the Middle Eastern culture due to the popularized hookah smoking. Those with diabetes may need further teaching with holidays that include fasting such as Ramadan and Eid, which can include teaching them to eat slow-release carbohydrates before periods of fasting, and frequent blood glucose monitoring. Mental health disorders are not commonly accepted in the culture due to the view that if you are following the tenets that it's not possible to have a mental illness. So breaking down mental illness in physiological terms, as you would, such as hypertension, may help break down the barriers towards them seeking treatment or accepting treatment. So the traditional approaches to illness include the use of homeopathy, naturopathy, massage, and meditation is common. So that's the use of a lot of herbs and really just natural resources. And then spiritual healers are also common, which were the imams. So diet, common foods include rice, vegetables, and a small portion of meat. Diet restrictions, they can't eat pork products. Non-halal animal fats are prohibited. Any animal that has been slaughtered in the name of another deity is prohibited, such as any god other than Allah. Alcohol is also prohibited. So some nursing considerations for their diet. The restriction of pork products also includes the restriction of gelatin because it contains pork fat, which some medications do contain. So it's really important to be a nursing advocate if you see a medication ordered for them that has gelatin. So magnesium stearate is prohibited when it is derived from animal sources unless the situation is life-threatening. Accommodations may be needed to allow food brought from home when in the hospital. Alternatives can include eggs, fruits, vegetables, and seafood. Due to the religious holiday of Ramadan and Eid, accommodations may need to be made to have food provided at different times. Although the ill are commonly accepted from fasting, they may still be observing it, so that has to be assessed. And then prayer times may also influence when meals are provided. So for those with diabetes, teaching is required about fasting, on diabetes control, the risks, and the strategies to avoid potential problems. And as I said before, nonverbal communication. So typically, same gender people, typically males, handshake with the right hand only, with the left hand on the elbow. And then if the healthcare provider is of the opposite gender, eye contact and handshake may not be initiated as a sign of modesty. Eye contact can be seen as a sign of disrespect, especially if the client is elderly. So privacy and dress. Women are very modest in dressing. Wearing hijab or any of the different types of traditional Muslim headwear. It really depends on which generation they're from and how conservative they are. And typically, they only expose their hands. Men are also modest, wearing pants at least to the knees, and silk is seen as a sign of luxury, which is forbidden due to the modesty of the culture. So some nursing considerations for privacy and dress. When you do a physical assessment, only uncover the parts necessary and tell them beforehand about what you will be uncovering. If a same-sex healthcare provider must be present, having a third person that is of the same gender may be necessary and may be an acceptable accommodation for them. And those are my references.